For the performance and diagnosis, we used video analysis to observe our client and a motion of him demonstrating the sitting up in bed and standing up from a bed. This movement is critical in daily living. Being able to have full autonomy and movement to get out of bed every morning to stay active and to continue living a life without being bedbound is crucial. The older we get, the more compensation to movements we adapt to, and this can lead to regression in critical movements that are used in everyday living. For instance, with the video analysis, we observe that our client, first, has a syndrome called upper cross syndrome, where there is an imbalance of tightness and weakness in the torso. The individual often exhibits a forward head position, rounding shoulders, and increased thoracic kyphosis. This misalignment can lead to compensatory movements in the cervical and lumbar regions during attempts to rise from a lying position. The client also demonstrates a weak core engagement. Weak abdominal muscles can lead to decreased stability in the lumbar spine, and during the video analysis, the individual exhibited excessive flexion in the lumbar region to compensate for the lack of core support and relying on other muscle groups, such as the hip flexors. The client also heavily relies on forward momentum to raise the upper part of his body, as well as he shows a lack of range of motion in the shoulders and pelvis when trying to get up. This can hinder his ability to use his arms as support when getting out of bed. Overall, this can increase his time also to complete the task, which could cause fatigue and or cause for him not to complete the task. Getting out of bed, he exhibits weak leg muscles that propel him out of a seating position. He exhibits a posterior tilt. It shows an imbalance in the hip flexors, abdominal muscles, tightness in the hamstrings, and glutes. This can impact their gait, and also it will show that they have more of a rigid walking pattern that can also hinder their balance, mobility, and cause pelvis imbalances. It can also affect their stride length. The client also shows facial expressions indicating discomfort, particularly in the initial push-off phase. This can suggest that the pain may be a barrier to their mobility, which will need to be addressed. Lastly, he shows a decrease in muscle strength in his lower body, affecting the ability for him to stand up and get out of bed. So what happens now? To further assist this client, we want to begin by adjusting core strength, incorporate mobility, and increase range of motion, as well as applying functional strength training exercises to address the imbalances, while also taking into consideration his mobility, as far as putting those joints in a full range of motion when having to do set task. The long-term goal will be to achieve independence, to be able to sit up and get out of bed, reduce reliance on arm support to propel him forward as he's getting up out of bed, and to improve the overall lower body strength and to improve his gait, which will also decrease the risk of him falling.